So, John, it is lovely to have you on the Integrative Medicine Matters podcast. Just want to ask you that question. Why does integrative medicine matter to you?
Well, first of all, thanks for having me. It's great to be on the podcast. Yeah, so for me, it's kind of what I've been passionate about for a very long time, which is this kind of whole person care. So when we think about health, especially when we go into it in the first place, we want someone to feel better. And that means physical health, it means mental health, and it means social health. And for me, without those three all being aligned, even if someone's, blood markers are well controlled, even if their blood pressure is well controlled, actually, they don't always feel the best selves that they could be. And for me, that's about feeling healthy. It's not just the absence of disease or the absence of markers of disease. It's that complete feeling of good health. And for me, I think integrative medicine, lifestyle medicine, prevention medicine has a lot of overlap in those areas around aspects of our health that we can really optimized to a certain extent to make us feel really good for now and in the future. And I suppose in my day job in the NHS, it's not quite as much about chasing those things sometimes. Time limitations and just the way things seem to work mean that often we're looking at markers, we're monitoring diseases. And although that can all be really, really helpful and really kind of functional sometimes, I think for me, actually really getting to the grips of what things are important for that individual in terms of what things we can change for them to make them feel the best version of themselves, I think is what kind of encapsulates that term integrative medicine, which, as I said, I think has a lot of overlap with kind of prevention medicine and lifestyle medicine too.
Yeah. And that integrative medicine model of conventional lifestyle, holistic, functional, we'll be focusing in on lifestyle medicine today. And yeah, just kind of go into that in a bit more detail. What is lifestyle medicine?
Yeah, so lifestyle medicine is the form of care where we have evidence-based mechanisms to enhance kind of behavioral change techniques, working on those six key areas. So physical activity, nutrition, sleep, mind, and mindfulness, for want of a better word, avoidance of harmful substances, and ensuring social interactions with other individuals, and making sure that those things are working in a way that suits that individual. And I think for me, one of the things that there is so much overlap with integrative medicine and lifestyle medicine is that person-centeredness. For one person, lifestyle medicine or focusing on those lifestyle factors could look something very different to another individual. And for that reason, it has to be this kind of one-on focused care where you get more time with an individual to really work out what's important for them, what things make them feel good, and what things are going to help them feeling good, not just now, but the future. We talk about behavioral change, and some of the key factors are having someone to keep you accountable, but it's also making changes which you can fit into your life going forward. I'm not someone who does swimming very often. And if I turned around one day and said to someone, I need to get a bit fitter at the moment, things have got a bit slack, and they just say to me, look, you need to just swim every day. But like, well, yeah, well, that'll obviously get me fit, but that doesn't fit into my lifestyle at all. I don't even have access to a pool right now. So, these kind of things need to be considered. And I think that's where it can kind of all come together with this kind of focused plan for an individual using evidence-based techniques in those kind of key lifestyle areas.
Yeah, and that idea of personalized medicine where you tailor it to the individual. So with your way of working, you're a busy GP and I think you have some separate lifestyle practice, but when you're working with people to create change, do you also work alongside health coaches or do you provide that element of health coaching within your personal practice?
Yeah, so it's essentially a case of what's available at the time. So if we're looking at the NHS practices which I work, there are some situations where health coaching is available. We've also got social prescribing, which can be another element of health coaching, which can be really helpful, especially with their links to the local community and local resources, which can be essential in helping someone make those lifestyle changes. So when the opportunity presents itself, very much so, and I do believe lifestyle medicine and integrative medicine is really an MDT approach, so a multidisciplinary approach to help someone feeling better. In my private practice, it's more just me, but it's something that I'm quite passionate about in terms of playing that role of the health coach as well. And it's something that I've had involved in my life in certain aspects of my health. And it's certainly a role which I can see being very well played in the lifestyle space as well. And it's one that I feel I do alongside that. And in the future, my private practice might mean that sometimes that is incorporated as well. But at the moment, it's just me leading that on that side of things.
And this prevention piece, this seems like, the NHS 10-year plan is really trying to grapple with the prevention piece. But I notice that it's very hard unless you also see whole person care and the empowered model that you're discussing and brought in right at the beginning. I just wondered, do you have ideas about how the NHS could really drive that prevention model in a very practical way?
Yeah, very much so. I think there are lots of our chronic diseases, it's about 70% of them are rooted in kind of lifestyle factors, many of which we could make a huge difference to either by reducing the risk of or reducing the impact of, or even some cases reversing them. And I think really it's about that time element. Now, obviously, the NHS doesn't have unlimited resources, which makes it quite hard to deliver this in large scale. However, ideas like health coaching, leading group sessions in which lots of information can be given to multiple patients at once, these are all kind of methods of delivery which definitely do seem to work. And my personal thought is, especially when we're thinking about some of the conditions that we're going to be tackling in the future, one of them big ones being obesity, with lots of the obesity weight loss drugs, which are obviously becoming more available and they're only going to become more available. One thing that has been highlighted is this need for wraparound care. Now, I almost want to go back to the government and say, to be honest, I think the wraparound care should be the core and then
Mm.
that the medicine should be the kind of icing on top. Because if we get the wraparound care right, actually, we can help people achieve these kind of weight loss goals of what you're aiming for. And in fact, if we're looking about the cost of weight loss surgery or even these long-term medicines, actually employing coaches and health coaches to deliver this level of care with maybe the backup of a GP or a well-practiced nurse in those situations could actually be all you need. I'm hoping this wraparound care is seen as a real core part of that delivery of the care for obesity. And I'm hoping that that will then divulge into other services. So diabetes is something that's quite close to me in terms of I'm the lead for diabetes in my NHS surgery, and it's something that I feel is going to change dramatically in terms of the way we use medicines within diabetes. But alongside that, I think the coaching and way that we counsel patients on the form of diabetes and how it's come to be in the first place for individuals, the causes, those downstream moderators or mediators, that we know contribute to the condition. If we're able to counsel on those things better, I can't help but think outcomes for diabetes are going to improve dramatically, especially if we have these new medicines, which are also going to be very helpful indeed too.
Yeah, I was listening on the radio 2 to people ringing in around their use of the GLP-1 agonists. And one woman said such an interesting thing that prior to starting the injection, she imagined she was already on them and started to lose weight. She did go on to use them, but I just wondered if you'd help our listeners and viewers just understand what that wraparound, what is that word? What does it mean, wraparound care?
Yeah, so wraparound care for me is this lifestyle medicine package.
Mm.
So we're looking at making sure that someone is physically active and not just physically active, active in a way that suits that individual. As I alluded to earlier, telling someone to swim when they don't swim is totally pointless. An activity doesn't need to look like running half marathons, running marathons. It can actually be as simple as walking. It can be as simple as chair-based exercises. But we know that those levels of activity contribute dramatically to the way our bodies do things and the way our body produces certain positive mediators of health in our body. So anti-inflammatory cytokines as an example, as well as endorphins and lots of other chemicals in our body, which help our body just work and function in a way that it's meant to. So, and that's just touching on the physical activity side of things. So there's nutrition as well. We know lots of kind of oxidative processes go on. And if we're able to eat the right foods, then actually we're reducing kind of damaging products which are in our body. We're increasing antioxidants and again, helping our bodies just be in a better position. And then again, when we come to other aspects of this, when we think about mindfulness and our mental health, we know how much stress contributes to a body which doesn't work in the same way. And so actually making sure we concentrate on those side of things as well. So for me, it's the physical activity, it's the nutrition, it's managing their stress in the right way, make sure we can got the right social connections and mediating those to the individual so that, they may be on this medicine, which is having a really good job and doing really, really well. But actually there are other aspects of our health that we're moderating as well. I think one of the big things is with these medicines is we know that they do contribute to a significant amount of weight loss, but we know if we don't get the physical activity and the nutrition right around that, that can lead to a majority loss of muscle mass, which we
Mhm.
actually know if we're looking at kind of predictors of long-term health and long-term functionality. We know that muscle health and muscle strength is one of the strongest contributing factors to allow someone to live well into old age, which obviously has to be a priority for us with our ever-aging population and with other medical advances becoming so strong. So unless we provide that level of care to someone, which is unfortunately what I'm seeing a lot of the time, people are getting these medicines from anywhere and everywhere, but they're not being counseled appropriately on what they should be eating, the way they should be eating, the way they should be moving. And that just means in some ways, I personally feel we're not doing people a good service by giving those medicines in that manner. It needs to have that accountability and wraparound to support the best use of those medicines.
Yeah, and as you know, I'm interested in intermittent fasting and prolonged fasting, having personally finally been able to lose over a stone, otherwise gaining weight, gaining weight, gaining weight, and dropping carbs, understanding around carbohydrate. It's frustrating to me to see the rise of the weight loss drugs because, although it takes work, it's also then becomes very enjoyable because you've got sustainable weight loss. I feel fitter, more energetic, able to do more exercise. I guess the question for me, is I love the fact that you're a living example of integrative medicine in that you're a frontline GP, diabetic lead, offer the GLP-1 agonist, but you also want to see this sustainable care. I wanted to ask you a practical question. Have you seen this rebound effect when people stop the jab? They then feel more hungry. You know, the way the body has this incredible homeostasis when you release the receptor. Have you seen that where people, feel hungry and really it's a struggle to manage it?
Yeah, unfortunately. And I see it particularly in patients who, if I'm being honest, aren't being provided the level of care they need with that wraparound. So the
Mm,
psychological support, the support
mm,
around proper lifestyle advice to support that medication. And there are lots of reasons potentially behind it, but ultimately we know that for the majority of patients, unfortunately, they will get that increase in appetite. And
mm.
whether it spikes or whether it goes back to what it was before, which is quite not having hunger and losing weight is in a way it's quite easy on the mind because the reason why weight loss is so hard is because of those hunger signals. So when
Mm,
it becomes that those hunger signals go away and suddenly they come back, it's sometimes quite hard to remember how difficult those hunger signals were. But
yeah.
we know how difficult those hunger signals are because it stopped many people losing weight for a huge amount of time. And it's why weight loss is so, so difficult. And
Yeah.
there is something to be said for these set points. Individuals have these set points in weight, which their body quite likes to be at, especially when they've been at that weight for a long time. So when the body is then made to go the other way, you're right, almost when it's a lot further from that point and that hunger signal has been muted for so long, it comes back with a vengeance when we stop the medicines, which is again why I feel this wraparound care, counseling appropriately on the medicine is so vital. Because if people aren't made aware of that, and I've seen that quite a lot, people then end up in a much worse position because say they've lost 15 kilograms in weight, but 40% of that, which is as high as it can be, could be muscle mass. And
Mm,
then they put on weight further, but none of it is muscle mass. they're in a position where they're just carrying all this extra weight. And actually, they haven't got the muscle mass to support that, which then leads to musculoskeletal problems and other inflammatory problems in the background, and a range of other risks of other chronic diseases, which just means, unfortunately, someone's been on this medicine, often at great cost to themselves, had to stop it maybe because of financial reasons, and then they're in a worse position to when they started.
Yeah.
It's really difficult.
Really difficult, and it's great to think that there's someone like you advising. But I also know from my own experience that, like this morning, I had some delicious keto bread with some walnuts, and I'm, mid morning not feeling hungry. If I have some ordinary carb bread with a bit of jam, I can feel my hunger being triggered within a couple of hours. So
Yeah.
again, that messaging around keeping your insulin release low and slow, this low insulin lifestyle, it's just lovely not to feel hungry, because often when you're feeling hungry, your body's also pressing you, like you're not feeling right. So I think there's so much for people to learn. And of course, none of this costs any money ultimately. If we get this messaging out again and again, no one's going to really make money. Whereas with these drugs, they make huge amounts of money. So I just wondered how you see that modeling where you do get the wraparound. Do people just move into like a model of being a champion and helping others who've been through that process, or that kind of group medicine as well?
Yeah, I mean, I think it can look like many different things, to be honest. I mean, one model is where you have a lead practitioner who manages those who are on those medications. They see you initially and maybe every so often to check in, see how the medication's working, see how the interaction with other medicines, see if other medicines need to change, because that's another really important part of this journey. As people lose a lot of weight, blood pressure medications, diabetes medications,
Yeah.
these all need to be altered and made sure to not be too high a level now, because that individual's at a lower weight, which may not need the level of drugs they had before. So you could have like an overarching clinician, and then off the back of that, more regular health coaches or even nurse input, which would allow accountability. If we're looking at kind of thinking big, dietitians involved in this process
Mhm.
as well,
Mhm.
because although it's something that I'm, done some extra training in, I by no means claim to be an expert in a very complicated and difficult subject. And you've highlighted there in terms of your own journey, the importance of this kind of food volume and the correct talking to individuals about kind of what foods to eat. And again, that's something that even as doctors, I know I personally wasn't that familiar with until I taught myself and learnt about it. So if we don't know it when we're meant to have done a whole degree on health, how are those in the community with so many mixed messages? And yeah, I think you kind of also highlighted in terms of your depiction of what this breakfast was, and then we've got these weight loss medicines in the background. We've got this kind of this almost battle going on of like big food who are producing foods which are unfortunately addictive. And there are even studies which the food companies fund to see what functional parts of someone brain is being activated when they eat certain foods. So you've got the food company who are literally trying to make foods addictive, and the other side you've got big pharma who are trying to reduce that appetite. So one's trying to build that appetite, one's trying to reduce it, and the individual's caught in the middle. And it's a horrible place to be, because it's one where your body doesn't really know what to make of all these mixed messages of, okay, well, I'm hungry despite eating now. That's strange. I shouldn't still need to eat, but maybe I am still hungry. And then you've got drug companies who are just canceling that thought process at all. And
Yeah.
then you lead to problems of people not eating enough food. And then people are becoming malnourished because of that reason. So yeah, I think it's a really complicated world that we live in terms of not being able to just listen to our normal hunger mechanisms anymore because of the food environment that we're in.
Yeah.
And yet I've kind of gone on a bit of a tangent there, but going back to this what this wraparound care could look like if you had those health coaches who could keep accountability, and you could even do that in a group setting within the NHS. I personally think that is something that is relatively deliverable and achievable, as long as you had that clinician kind of keeping an eye on everything and obviously noting if changes needed to be made to medications and things, which again wouldn't be a huge difficult thing to manage. But I do personally believe that would be a far more effective way of managing, obesity especially, but diabetes too, going forward. And again, it would just provide that whole person care to that individual.
And you do like really emphasize the way that we disconnect. There are forces at play that mean we disconnect from our bodies. And I often feel the journey is to reconnect, to
Mm.
feel what we're feeling and to take charge somehow. So that accountability piece is only the stepping stone to actually feeling like I understand my body. I know what it needs at this point. And it's a great shame, isn't it, that it's almost like our separation from natural rhythms of growth, of food, of eating together. There's a lot to tackle, isn't there, at a societal level, but also even bigger than that, these big global forces that come to play as well.
100%. I mean, food's meant to bring us together. Food's meant to
Mm.
be community. Food's meant to be relationships and building. Whereas it's become this thing which, for so many, is a real problem area. Whether it's that they feel that they need to eat less, but they're constantly fighting their hunger signals because of the food in the environment. Whether they're eating foods which are just actually making them less healthy and therefore they find that relationship even more difficult. Prevalence of eating disorders and things like that make that relationship broken as well. And a lot of it all comes from us not really almost being able to trust our natural hunger
Mm,
signals anymore
mm.
because they're being tampered with one way or another. And that makes it really difficult. I know I really struggle in NHS work when a patient comes to me, and often it's not top of the list talking about someone's diet. It's often a 1 minute conversation that you have to fit in at the end. But there's just no way you can tackle such a complicated subject for anyone in that time. And, we can try brief interventions, which there is some evidence they can be helpful, but it's so complex and then there's so much to it. And, even if we take individuals who live in the same house, their nutritional intake is very different. And that's because they like different things and they have a palate for different things, which means that giving general nutrition advice to individuals is very hard.
Yeah.
I mean, the other aspect of it that I always come back to is cooking,
Mm.
and the lack of ability to cook in our population makes actually avoiding, we keep talking about processed food and how bad processed food is. Well, the only way of avoiding that is if individuals can cook, and a lot of people can't cook. So
Mm.
saying to someone, okay, well, your blood pressure's a bit up, you could eat a bit better, avoid processed food. I'm sometimes met by people saying, well, I literally can't cook. So where
Yes,
do I even start?
we take that really seriously. We do cooking from scratch. We do
Yeah.
it for undergraduates and for just the public because getting to know foods and know where to buy them and how to buy them inexpensively, and then knowing how to cook them. There are lots of steps there, and then of course just enjoying eating. The other thing I wanted, you something of a specialist around physical exercise, and I'm thinking of one person I know who's very overweight, had pancreatitis, so I don't think would be wise to have one of the GLP-1 agonists,
Yeah.
but moves very little because she's overweight and her joints hurt and her body hurt. How do you start to tackle that journey? We've got kind of the cooking from scratch at that, but what about this physical exercise?
Yeah. It's a really difficult situation with physical exercise, especially in those who are overweight. I think we've got the conversation wrong slightly when we approach physical activity, though.
Mm,
And the common thing that is said to me by patients, but by friends and family as well, if someone's even just carrying a little bit of extra weight, the first thing they'll say is, "Oh, I'm going to go to the gym tomorrow. Or I'm going to start on that exercise plan." And the evidence seems to show us that actually, unless you do a really high amount of physical activity, that scale doesn't move a huge amount. Actually, concentrating on other aspects of why we're eating more is actually probably more important. So, sleep and nutrition. But just to
mm,
bring us back to physical activity, the nice thing that we can say about physical activity is the huge benefits that it brings to anybody and everybody. So, we know hitting the physical activity guidelines reduces our risk of diabetes by about 50%. It reduces our risk of heart disease by about 40%, risk of arthritis symptoms by about 50 to 80%, and then risk of colon cancer by 50%, breast cancer 20%, anxiety and depression 30%, dementia 30%. These are huge numbers, which
Mm.
if we had the ability to put that into like a tablet, can you imagine how popular that would be? But the point being that actually being physically active is so much more than just losing weight, and we get all those benefits. So that's one of the first things that I try to stress to an individual who is overweight. And you could say, well, why are you telling someone who is overweight that, being physically active won't help that? Well, I'm doing it because if they do think that physical activity is the way to cure their weight problem, they're going to be disappointed, and they're going to think that the physical activity component of what they're doing has failed, when actually it hasn't at all. It's doing a great job, and there are loads of other benefits that that's bringing. And actually it also allows us to then educate on the things which are going to make the big difference to that individual, which actually then means that they have success. So I think it's almost vital that we do that. So to bring it back to your question, I'd say a few things. I'd say we need to make sure that that individual is aware that the physical activity isn't going to be the thing which cures that weight loss journey. We need
Mm.
to make sure that they appreciate all the huge benefits that physical activity brings them, even if they just do a little bit more. I talked about the benefits that happen when we hit the guidelines, but actually just doing a little bit. If someone's doing nothing at all, if someone just does a little bit, they're getting huge benefits to their overall risk, or reducing their risk of disease or progression of disease. And the last thing I'd say is encouraging them to do things that they can do. So you've mentioned there, which joints are hurting? Okay, it's the knees. So what about chair-based exercises? Can you grab some exercises that you look at? So NHS Choices, for example. But I quite like using a lot of the social media stuff. So like YouTube is a great example. Just type in chair-based exercises on YouTube. And actually there's loads of good stuff out there. My mum had to have surgery a couple of years ago on her foot. And she's someone who loves being physically active. And she kind of came to me and said, what do I do here? How do I continue to get the benefits of exercise? Because she hears me talk about muscle myokines and cytokines and all the benefits that you get. And we just did a little program around some upper body activity, and she got totally sorted on it and absolutely loved it, was doing it every day, and
Mm.
started off with some bean cans, progressed up to some light weights, and then we kind of increased the activity as she went, and she was able to get really good healing, like to the point where the surgeon was like, I'm quite surprised you're healing this well. Postmenopausal woman, lowish calcium levels, does have good amount of calcium in her diet, but it has osteopenia in the background. So there are reasons there why her bone healing wouldn't have been that good. But the consultant looked round at the images a few weeks later and couldn't quite believe it. And obviously that's anecdotal evidence. But my point being, I think it's about tailoring to that individual, stressing the benefits that that can bring, and coming up with an individualized plan which allows them to be consistent with it. And in most situations, if they can be consistent with it, they often do feel the benefits, and then they keep going and often progress, to be honest.
I love that, because in a way what you're doing is turning round that kind of feeling of, there's nothing I can do, I can't get over, the first hurdle. And of course that makes people despairing, and sometimes they'll eat then. So
Yeah.
what you're doing is just creating hope, um, in that very practical way. And then of course we know, once you get movement in any part of the body, you'll reduce inflammation. But you mentioned the muscle myokines. Tell us about muscle myokines. What are they?
Okay, so muscle myokines are basically these cytokines, which are basically chemicals in the body, which are released when we activate muscle. So you're totally right there. So, we have a background level of inflammation, which can be caused by a number of things. So visceral fats, sedentary behavior, if we're talking about harmful substances, smoking, nicotine, all these things, which lead to this kind of pro-inflammatory effect in the body. And this can lead to atherosclerosis. It can lead to other factors not being produced properly, like chemical factors in the brain, like brain-derived neurotrophic factor, which helps neuron development and all this kind of stuff. Whereas with muscle myokines, when we stimulate the muscle, we produce particular anti-inflammatory cytokines, interleukin 2, interleukin 6. Now, interleukin 6 is a bit of a tricky one, because interleukin 6, when it's produced by muscles in great quantities, it's anti-inflammatory. But when it's produced alongside TNF-alpha in, say, visceral fat, it's actually pro-inflammatory.
Right.
So kind of works in both ways. But The key being there are loads of these different cytokines which either work in a bad way, inflammatory, or in a positive way, anti-inflammatory. And if we can get them to go more that way of the anti-inflammatory, which is what happens when we activate muscle, it leads to this lower level of inflammation. And I think we're only just at the kind of start point of understanding the extent of this inflammation, to be honest. We know those who are obese, those who have certain chronic conditions, have this lower grade inflammation in their body. And the way that that can contribute to even conditions like osteoarthritis and a range of others, I think we're only going to learn more about in the future, because we know that in most situations when we reduce them, we see, different levels of chronic disease, much lower levels, healthier bodies, healthier cells, healthier mitochondria, and all that stuff, which we know leads to, longer life and better quality of life too.
Yeah. And more mitochondria, more energy. What about later life? We talk about later life, 55 and over, but, what about kind of the elderly, people on maybe beyond 70? What would you be recommending in terms of lifestyle, or what things do you celebrate in that phase of life?
Yeah. So again, it comes back to those kind of key lifestyle factors. I suppose the main takeaway points for me are we know that those of later life are more likely to thrive and be functional when they've got strong legs. And all the studies seem to show that. So that can be related to grip strength as well. So those who've got a stronger grip and stronger legs tend to do better functionally later in life. And that's just shown across all the studies. And in fact, if we're looking for the best predictor of a long life and a healthy life, it seems to be that one factor, leg strength. But as I said, that can also relate to grip strength. So for me, or one of the best things we can do is keep active, and that can range from walking, but I'm very much a fan of encouraging those over the age of 55 to resistance train. We know this massively reduces the risk of sarcopenia being kind of the breakdown of muscle mass. And again, when we're talking about kind of studies which look at longevity, increased muscle mass or maintained muscle mass over time seems to be one of the biggest factors in terms of reduced mortality and reduced risk of death. And in fact, we even see that in obese individuals. If we have weighted individuals who are overweight, if they maintain their muscle mass, we often don't see such a increased risk of their chronic conditions because of that muscle mass being protective. So muscle mass, making sure we're active, but I'd also say making sure people have a good diet, which is, got good volume to it. But when I say good volume, which is kind of, again, what you alluded to with your example, making sure there's good a protein amount, because we know that muscle protein synthesis happens at certain dosage levels, say in a 20-year-old, but those doses need to be higher when we're talking about an elderly person. The response to a protein intake or a protein meal is different. So if we want that individual to continue to build muscle from the protein that they're eating, then we need to make sure that that dose is slightly higher. And again, that's tailored to the individual, how much they weigh and that kind of thing. But those would be the two big areas. I'd say three big areas, actually, because I think one of the big things, which I've seen highlighted in many conferences and through many specialists, is this idea of loneliness being a really strong predictor of increased mortality as well. And that makes sense, doesn't it? Loneliness means that lack of purpose. It means lack of that social interaction, which we know is so important for health. If we're looking at the blue zones, that's one of the big key drivers of why those populations live so long, is because of that community. So I'd say those would be the three big areas: physical activity, making sure we're concentrating on muscle building exercises, getting the right diet, good amount of protein, but high volume generally with lots of phytonutrients. And then last thing is that community. So trying to avoid loneliness at all costs, as difficult it is to do that in our current UK system, but any system really.
Yeah, lovely. And just a bit more on resistance training. Like, what can you do simply, maybe at home, not going to a gym, to build? Yeah, what's even meant by resistance training?
So resistance training is any form of training which is a repetitive movement to strengthen a muscle.
Mm.
So that can, as I alluded to earlier, can literally be lifting a can of beans. Now, the important thing is you need to be stimulating the muscle in a way which actually tires it out. You could probably do 100 bicep curls of a baked beans tin, and it probably isn't going to give you a huge amount of benefit. Don't get me wrong, it's movement, so it's going to help. But actually, if we're talking about kind of progressive training, it's making the quite tired and fatigued. And that's when we know that the kind of best stimulus is made. And that means we're strengthening and, making the muscle stronger to do things going forward, and also fighting off the risk of this sarcopenia, which is the breakdown of muscle. Because if we don't work a muscle, unfortunately, we know it will decrease, and muscle mass decreases by about 1% a year from the age of around even 35, 40, can even be younger in some individuals. So it's important to be stimulating that muscle to avoid that kind of breakdown of the muscle tissue. I mean, it can look like doing classes online. It can look like YouTube and looking up very simple things. Availability of weights and things to do this kind of stuff with is a lot easier these days. And as I said, there's so much information about how to do it. The amazing thing about AI these days is you can even ask AI to just make a program for you, given the AI your demographics, your age, your weight, and say, please make a strengthening conditioning program for my legs for 3 days a week. And incredibly, it will just give you everything there. And you say how to do the exercises and it will do it for you. So there are certainly means and ways of doing this where, to be honest, most people should have access to that to be able to come up with a program. Obviously, the more benefit you're going to get is from an individualized program, which again comes back to this person-centered care, where you've got a practitioner who's really looking after all those things and making sure you are progressing in the right way. But there are other ways of doing it, and AI is a pretty good tool to help that.
Yeah, I think it can be really, really useful. And I've noticed my friends who are over 70 benefit enormously from doing resistance training together. I think that's the other
Yeah.
thing is you might put it off, but if you're going with a friend or a buddy, they tend to kind of keep you on track. So again, it comes back to that community
Yeah.
and that connection.
And the accountability. I mean, we know it's one of the biggest predictors of a behavioral change habit being successful is that kind of accountability. And whether it's in the form of community and friends, or it's the accountability of a coach or a trained professional looking after that, we know that's one of the most likely markers of success is having that. And Parkrun's a really good example of that for many. Lots of GP surgeries have linked in with Parkrun, and there are countless stories that I can think of now to patients who have made huge changes. And again, because it's not just the physical activity thing that they've changed, they've become encapsulated by that Parkrun community, which has then led on to other further health changes. And again, just kind of this, again, we come back to this wraparound care that they've ended up having from an unlikely source in Parkrun, but it's made a world of difference and it's changed lots of people's lives. It's amazing.
Yeah. And within our master's program, we do a whole module on social prescribing. And one of the learner group, we're just presenting the evidence for Parkrun and also the way people with disabilities or illnesses are also supported in that environment. So I remember we did a conference just as I was setting up the National Centre, and the park run was about to fold due to lack of funding. But, it was just great to see that now it's unstoppable, isn't it? So many people do a park run.
Yeah. Yeah, it's a growing community. There are so many involved now, volunteers, and yeah, I'd love to see in 10 years' time the health outcomes that have come from Park Run. I think the only thing that the one thing I'm worried about with Park Run is it's a 5K, and I think we've
Yes.
normalized doing a 5K, which is no small thing to do.
No.
um, I'm quite lucky. There's a friend of mine who a few years ago said to me, "Why don't we set up a running club in Bath?" And we've actually set up a run club called Bath Fit Fam that runs on a Sunday. And this is we have like a loop of our local park, which is 1.25K. And we've basically said, you can come and run or, walk or do as little or as much as you like. And it's created this community where people I'd say they were the kind of the non-runners who like to run, because often we're not doing very much running, and it is about the community and it is about shorter distances. Children come along and get involved, see the importance of physical activity. We get a real huge age range as a result of that. And again, the biggest thing that comes from it really is community and the great strength that brings. And we've had some amazing stories off the back of that as well. But yeah, I think these kind of projects, so, Parkrun, Bath Fit Fam, these kind of projects are life-bringing entities, which I think we just need more and more of, really, as well as the social prescribers in place, as you alluded to there, to to point people in that direction of those fantastic projects.
Yeah, and I'd come if it's only 1.2K.
There you go.
It's always felt too much to me, but I did 2 hours of 5 rhythm dancing yesterday morning, and that
Wow.
was real exercise, and it was
Yeah, yeah, yeah.
really fabulous. So there are so many ways that we can move and connect and, yeah, and be with people. I mean, that's the key thing, isn't it?
Definitely. And as you said there are so many different forms of activity.
Mm.
I think it's so key that we stress the importance of it, but not make people feel excluded from it because they don't like a particular type. I hate the idea of people thinking, oh, this person's saying that I need to be active. I need to go and run a 5K. That's the last thing that I'd be thinking. Actually, it would be like, right, well, what things do you enjoy? As you've alluded to there, you like dancing. So that would be a great form of activity for you. And I've got a good friend who's a Zumba class instructor and she just loves it. But there are other forms of activity she absolutely hates. So,
Yeah.
it's about that. Again, it comes back to what we talked about at the start, really, this personalized care. It has to be tailored to that individual. And for me, especially from a physical activity point of view, we need to stress the huge benefit that that person's going to get, aside from weight loss if we can, but just stress how much benefit it's going to give that person's body now, feeling better now, but also for the future as well.
Well, I guess that does, bring us to the end of our fabulous conversation. And also, it brings this idea of diversity and choice. That's what I love about the integrative medicine model and lifestyle, that there's always something that someone could connect to. And it also makes us, I think, more hopeful, enthusiastic doctors because we're working with so much more in our toolbox. We know that at the end of a session, there'll be something that's meaningful, that because we're offering a lot more colors of the rainbow. So, any final thoughts? Anything else that you're excited about at the moment that you want to share with people?
Uh, Well, I think I am excited about generally about this movement. I
Mm.
think people are starting to really believe in it. I
Yeah.
think a few years ago I said lifestyle medicine to people and they looked at me and thought, you just mean doctors who enjoy being active and drinking protein shakes and putting their pictures on Instagram. And I feel people are starting to realize that it means so much more than that. And I hope people are starting to see, the real impact it can make to normal people within the NHS and beyond. And not that it just kind of helps reduce the risk of disease, but in some cases it can even prevent it or totally reverse it. And I think that's the exciting thing. I think things like the additions of these new medicines are like the cherry on top to help with the building blocks, which, as I said, those kind of 6 key components of lifestyle should be. And I think with more cherries on tops utilized well, I think we can really see some individuals make some really, really big changes, which, nothing short of changing their life, because I think these things can genuinely change people's lives. It's just having the right information from the right places and being guided in the right way, which I think allows people to make those changes.
Yeah. And if we are able to wind it back, as you said, to families, children, all getting these messages about how to stay well, that's the prevention model. And then when we do move into being out of balance or out of alignment, there are things there to kind of help us come back. And so that we're not kind of rattling down the alley into serious long-term conditions that then obviously are much harder to treat. So it is a movement for change that you and I are both very excited to be part of, where wellness and prevention of illness becomes at the heart of what we do.
Yeah, 100%.
Great. Well, thank you, John, and good luck with all your initiatives. Thank you so much.
Thank you very much.